Yeah, hi everyone. Once more, welcome to my channel. This is Dr. WAN, and I'm here to talk about diabetes as usual. And I'm gonna break it down into so many videos because if I make it too long, my listeners wouldn't be that interesting anymore in following what I'm saying. So it's gonna be kind of short video, and I'm trying to make sure that I use a layman term for you to understand me. The title of this video is as follows: if 3Ps mean diabetes. Again, if 3Ps mean diabetes. So the if here is IF. So IF stands for infection and F stands for fatigue. Then the 3P stands for polyuria, polyphagia, and polydipsia. So let me break it down now to the simplest term for you to understand. When you are suffering from diabetes, it could be type 1, type 2, or type 3. There's always something common in all these diabetes that I've just named. And that's what I'm here to say, the common symptoms on all the types that exist. So there's that tendency of you running to the washroom frequently, even at night. Some patients even urinate on the bed unknowingly. So please, if you find your elderly patient or your loved ones, they urinate on the bed, then please get them checked for diabetes. That it could be that they are suffering from this illness unknowingly. Another aspect, it is polyphagia. So polyphagia is that tendency of eating. You just want to have something time and again, keep eating, keep eating, keep eating. So that's what happened. And then the other one is polydipsia. So polydipsia means thirsty. You want to drink. You always want to drink. You keep drinking more. So those are the 3Ps. Then the IF, I stands for infection. Infection is quite common. For instance, when you sustain an injury, for the wound to get healed, it takes ages. And for F is fatigue. So I'm going to explain now each and every letter here, what is actually going on. That is the chemistry of diabetes, or we call it the physiopathology of diabetes, or disease mechanism. So let's start with I. So I, like I said, is infection, meaning that the urinary tract has liquid building up there. That's for you to urinate the waste. That waste now is highly loaded with sugar. And that sugar, if you don't eliminate it faster, you end up developing infection in the sense that fermentation takes place. And for that reason, I always recommend my patients and listeners to make sure that they take the medication called gliflozins. So the gliflozins are types of medication that belong to the group called sodium glucose cotransporter 2. Some books give the sigla or the acronym as SGLT hyphenated 2. So that's the acronym for sodium glucose cotransporter 2. And a typical example in that family, or we have Forxiga. Forxiga is a commercial name. The chemical name, it is dapagliflozin. So the flozins here means flushing. So remember, when you hear that word flozin, it means to flush it. So at the level of your kidney, precisely the convoluted tubes, that medication helps to take out that urine, which is we risk undergoing fermentation, out. So they flush it out. So, and then another one, it is canagliflozin, and then empagliflozin. So those are the three medications I always recommend to my patient if you are having diabetes and if the diabetes is not properly controlled, or when infection is quite frequent. There's no point me putting you on diabetic medication like Jardiance, metformin, then add antibiotics, except your legs are having kind of infection or something abnormal. Otherwise, I'm hesitant to put you on antibiotics because of what we call antimicrobial stewardship. It's a heated debate here in the scientific community when it comes to prescribing antimicrobial. So for that reason, we don't quickly put you on antimicrobial. We'll rather put you on the gliflozins. And the gliflozins, as I said, there are three of them. So we have the canagliflozin, we have the empagliflozin, we have the dapagliflozin. So those are the three medications popularly recommended in this case. So it helps to cut down the infection that you risk having as time goes by. Worst case scenario, we can now move to the antimicrobial if the doctor has done his assessment. So that's it. Now, F stands for fatigue. So fatigue now meaning that there is that demand of energy at the level of your muscles, but the energy is insufficient. Remember that diabetes, once again, it is the inability of sugar to get into the cells, what we say sugar internalization. So there is that defect of sugar getting into the cells. So that's why there's excess sugar in the blood, which we call it spillover. Spillover is what you experience when you go and do the test called HbA1c. So that's the whole thing here. When the sugar is able to get into the cell, the value of spillover in the blood drops. So the inability of your cell to be able to take in this sugar in your blood makes it feel tired. And so that's the meaning for that letter F. Then the 3P now, the polyphagia, polyuria, and polydipsia. So polydipsia, you are thirsty. Thirsty because when sugar builds up in the blood, that's outside the cell, there's that imbalance. So the blood itself now tends to demand for more water from the cells. So the water now leaves the cells into the sugar stream, and that's why you feel thirsty. And having said that, there's also that energy request. So you feel hungry because you need energy. So that's why you have to eat. And if you have to eat, therefore, you definitely need to drink also. So that's why I call it 3P. So always remember, medical students, I for infection, F for fatigue, P for polydipsia, another P for polyphagia, another P for polydipsia. So those are the three things here. So always remember this, again, the 3Ps and the IF. That will help you much more better in reminding yourself what are the symptoms for diabetes, be it type 1 or type 2. Once more, I'm Dr. WAN. Thank you for watching, and please don't forget to subscribe to my channel, love it, and share it with your loved ones. And now follow up with part 2 of this video. Thank you and have a wonderful evening. Ciao.